Dr. Michael Breu, also known as the Sleep Doctor, is a renowned sleep expert and a best-selling author and speaker. Throughout his career, Dr. Breu has dedicated himself to educating the public about the importance of sleep for health and well-being. He's a strong advocate for holistic approaches to improving sleep quality, combining science, medicine, and behavioral techniques. Have you ever wondered what the best sleeping position is? Have you ever asked yourself if it's better to sleep on one side or the other, or if sleeping on your back is healthier than sleeping on your stomach? In today's video, we're going to answer these questions and many more. I'm going to share with you the findings of one of the world's leading experts on the ideal posture for a good night's sleep. In addition, we'll discuss morning habits that can influence the quality of our sleep, the drinks and foods that can harm it, and even the effect of sleeping with your mouth open. One of the biggest mistakes people make is not knowing the right position to sleep in. First, let's talk about sleeping on your stomach. Sleeping on your stomach is often considered one of the worst positions for your spine because it doesn't support your back's natural shape. When we sleep on our stomachs, we tend to turn our heads, which can twist our spines and change their natural curves. Over time, this can lead to back pain after a night's sleep. If you're young and watching this video, you might sleep on your stomach. However, it's not a position I recommend because it can cause health problems down the road. Also, for those who worry about aging, sleeping in this position can make wrinkles on your face more noticeable. That's because your pillow can leave marks on your skin, which become more obvious over time. So, it's important to think about these things when choosing a sleep position. Look for healthier and more comfortable ways to rest at night. These marks or wrinkles can get deeper, making your face look older. That's why I think sleeping on your stomach is the worst position. Now let's talk about sleeping on your right side, looking at the good and the bad. First off, sleeping on your right side can be good for your lower back because it helps keep it aligned. This is a plus for a lot of people. However, here's something important to remember. Many adults have something called acid reflux. Acid reflux happens when the door between your esophagus and stomach doesn't close properly. When you sleep on your side, gravity doesn't help keep liquids down, which can make acid reflux worse. When stuff from your stomach goes up into your mouth while you're sleeping, it can cause all sorts of problems, like heartburn and a scratchy throat. The next day you might feel stuffy, have problems with your gums or mouth, or wake up with a burning feeling in your throat. These are all classic signs of acid reflux. Sleeping on your right side can make these symptoms worse. That's because your esophagus is closer to the right side of your body. If that door to your stomach isn't closing right and you sleep on that side, the liquid in your stomach can more easily go up into your esophagus, making the reflux worse. That's why, if you have acid reflux, you should try not to sleep on your right side. It's more likely that stomach acid will come up to your mouth. Studies show that people who sleep on their stomachs have more reflux problems. While not perfect for reflux, sleeping on your back can be good for your back, or if you snore, which we'll talk about later. One of the most common sleeping positions is on your back. This position is really good for your neck because it helps keep everything in line. In fact, a lot of experts, like physical therapists, recommend putting a pillow under your knees to help support your lower back. This simple trick can really help with any lower back pain you might have, and it's a great way to keep your back healthy while you sleep. Also, having a good pillow under your head can help keep your neck straight, which can prevent any neck pain or stiffness. However, this position isn't for everyone. For example, if you snore, have high blood pressure, or are pregnant, you might find it more comfortable to sleep on your side. For people who are overweight, sleeping on their back can be uncomfortable. It's important to think about your own needs when choosing the best sleep position for you. Overweight people tend to snore more often due to a few things, one of the main ones being a partly blocked throat. specifically the area at the back of your throat. When you sleep, the muscles in this area relax and can obstruct your airways, making it harder for air to pass through. Many people also breathe through their mouths, which makes this blockage worse, causing the air turbulence that creates the classic snoring sound. In more serious cases, snoring can be a sign of a more serious condition, obstructive sleep apnea. With this condition, people have short pauses in their breathing while they sleep. During these pauses, carbon dioxide builds up in the blood and signals the brain to make you breathe again. So your body starts breathing again, but these pauses in breathing cause the brain to briefly wake up, and your body releases adrenaline to restart your breathing. This can lead to high blood pressure and is especially dangerous for people who already have high blood pressure, as it makes their condition worse over time because it can cause difficult to treat high blood pressure. Sleeping on your back increases the risk of serious heart problems. So if you are overweight and tend to snore, this position might not be best for you, as it could worsen your blood pressure and increase the risk of serious health issues. For pregnant women, sleeping on your back is not recommended because the weight of the baby can put pressure on a major vein, reducing blood flow. This is one of the reasons why sleeping on your left side is often recommended during pregnancy. Now let's talk about my personal favorite, sleeping on your left side. It's a position that many health professionals recommend because of its numerous benefits. If you suffer from heartburn, sleeping on your left side might be the perfect solution. In this position, stomach acid tends to stay in the lower part of your stomach, reducing the likelihood of it going up into your mouth. Additionally, sleeping on your left side helps your stomach empty more efficiently and can even improve your bowel function. For those who snore, sleeping on either your left or right side can help, as gravity helps to keep your throat stable, reducing any blockage in your airways. Another advantage of this position is improved blood circulation. For example, pregnant women, people who are overweight, or those with poor circulation in their legs are often advised to sleep on their left side. This is because sleeping on your right side can put pressure on a major vein called the inferior vena cava, which carries blood from the lower body back to the heart. Sleeping on your left side reduces this pressure, improving blood flow and making it easier for your heart to pump blood efficiently. Improving circulation can also reduce swelling in your legs and even your face. In short, sleeping on your left side can offer a range of simple yet practical health benefits. When choosing a sleeping position, it's super important to keep 3 key things in mind. The first is your spine health. Making sure your spine is aligned correctly is really important to avoid any aches and pains. The best positions for this are on your back or on your side, either the right or the left. However, the best position is the one that feels the most comfortable for you. Sometimes it helps to put a pillow under your knees or between them if you sleep on your side. This can help with alignment. Make sure your back is straight, your lower back isn't being pushed up too much, and your neck is in a neutral position. You don't want it too stiff or bent, just comfy. The second thing to think about is your overall health. For example, if you have heartburn, sleeping on your right side can make it worse. If you have back problems, sleeping on your stomach is a no-no. For those who snore, especially if you're overweight and have sleep apnea, sleeping on your back can make it worse unless you're getting treatment for it. Each position can affect your health differently, so it's important to choose the one that works best for your body. Finally, don't forget about comfort. There's no point in having a perfectly straight spine or less heartburn if you can't fall asleep or if you're uncomfortable all night. The best position is the one that lets you sleep soundly and wake up feeling rested. If that same position also helps you snore less and supports your back health, then you've found the perfect posture, keeping in mind these 3 important things. Now, let's talk about the second common mistake: which we call roadblocks to rest. We're talking about things like drinks, food, and daily habits that can mess with our sleep. Let's start with drinks. We often hear the advice to start the day by drinking a glass of water with lemon, but we rarely talk about the importance of avoiding drinking water right before bed. This can lead to sleep interruptions to go to the bathroom during the night. A good tip is to stop drinking water about 2 hours before going to bed, as long as you've stayed well hydrated throughout the day, especially if you've exercised. Another essential aspect of a good night's sleep is reducing exposure to artificial light as bedtime approaches. Turning off electronic devices like screens and cell phones and making sure the room is completely dark promotes an ideal sleeping environment. Darkness stimulates the production of melatonin, the hormone that regulates the sleep-wake cycle and promotes sleep. We'll talk more about melatonin and some options for improving sleep quality later. The circadian rhythm, which regulates our body's rhythms, is fundamental and should be taken care of from a young age. Exercising in the morning and taking a short nap in the afternoon can help stabilize nighttime sleep. Physical exercise tires the body and muscles, leading to the release of substances that promote relaxation and physical and mental well-being after a few hours. Integrating a regular routine of rest and physical activity should be an essential part of our daily lives. Another important thing for good sleep is how we breathe, especially through our nose. Our nose is really important for breathing well. It keeps the airway clear and helps stop snoring. But lots of people sleep with their mouth open. This can cause noisy breathing in the throat and make snoring worse. Also, breathing through your mouth doesn't clean or warm the air properly, which can make your sleep worse. Some people try taping their mouth closed while they sleep to breathe through their nose. But studies show that this might not work and could even make things worse, especially if you have trouble breathing through your nose. So it's really important to talk to your doctor before trying anything new to sleep better. Now let's talk about melatonin. It plays a key role in regulating our sleep-wake cycle, making it easier to fall asleep and improving the quality of our sleep. However, it's crucial to use it cautiously and responsibly. Medications like clonazepam can be prescribed to help you fall asleep, but prolonged use carries the risk of dependence and can lead to additional health complications. That's why it's essential to carefully follow the guidance of a medical professional, as these medications can be helpful tools in treating sleep disorders when used appropriately and under strict supervision. To learn more about improving your longevity and health, check out the suggested video. In it, Dr. Campbell shares 3 foods he avoided to reach the incredible milestone of 90 years.